Good morning, and thank you everyone for joining today's office webinars for Long Island. This is for the Care Management Training Initiative. I want to thank you again for joining us today. And first, I would like to share with you today's format, which will be that we're going to briefly go over all of the webinars and videos that you've seen thus far that have been presented to you since March of this year. I'm going to briefly go over each of the webinars and the two videos. And towards the end, please feel free to send in your questions and comments. The purpose of office hours is for all of us to learn from one another and to review any areas that you feel you can help each other with or in the content that was presented. You can send in your comments and questions at any point throughout the webinar, or you can wait until the end, and we will make sure that we get through that. You can, on the right-hand side of your screen, you'll see a chat box, which you can enter your questions and comments. And if you would like to be unmuted, you can, there's a raise your hand feature on the right-hand side. Also, we can unmute you if it's easier just for you to say your question or your comment out loud. All of these webinars of the office hours have been scheduled regionally so that it is a smaller audience in order to give everyone an opportunity to ask questions and to share. So I'm just going to go over a little bit some things that you guys need to keep in mind or review. Slide is not advancing, but that for attendance, if you're viewing as a group, please make sure that you put in everyone's name so that you can receive credit for it and that you will receive a certificate of attendance at the end. If you are needing CEU credits for social work, for LMHC, for CPRP or CRCC, please fill out a evaluation at the end. That is the way you will receive credit for all of the webinars you've viewed, including today's webinar. And finally, all webinars should be reviewed no later than November 30th in order to receive credit. There is one more webinar left, which will be held on October 18th. And that's topic is health literacy, so please tune into that as well. Trying to advance the slides, but it's not happening. So a little bit about me. Again, my name is Melissa Thomas, and I'm the Associate Director of Training here at the Coalition for Behavioral Health. I also want to thank our partners, the New York City Council for Community Behavioral Health, the New York Care Coordination Program, the Center for Practice Innovations, the National Council, as well as the New York State Association of Psych Rehab Services. So today's objectives that we're going to go over to discuss today is the definition of integrated care and your role as a care manager, elements of motivational interviewing, how it can be used with spurts, getting to know the culture of the person and the community, why outcomes are important, the care manager role in care transitions, the benefits of supervision, and finally understanding the importance of self-care. So we're going to go over all of that in a moment. So we're going to start off talking about what is integrated care. And the definition of that is, at the simplest level, integrated behavioral and physical health care occurs when behavioral health specialty and primary care providers work together. I want to stress working together to address the physical and behavioral health needs of their patients or the people that they work with. Unfortunately, this doesn't happen as often as we would like to, or as often as it should, but in your role as a care manager, you play an integral part in making sure that care is integrated. And when we talk about the triple aim of improving population health, which we do discuss in webinar number 11 on outcomes, that includes reducing costs, and enhancing the health outcomes of individuals. So integrated care in this aspect is key. Integrated care can also be bidirectional. So it's not just necessarily you referring someone to a primary care physician, but it should also be in reverse. We're hoping that primary care physicians also link folks who need behavioral health services to you as well. So chronic illness is the #1 healthcare problem in the United States, and outcomes for people with mental illness are less hopeful than the general population, yet most illnesses are preventable. So some of those illnesses that can be preventable include diabetes, heart disease, hypertension, and obesity. And in your role as a care manager, it is very critical you can help improve the health outcomes of the people that you serve. You know, or you should get to know the whole person and what their needs are physically and in relation to their behavioral health and how it can impact on the social determinants of health, which we'll talk about a little bit later. Integrated care is very complex and does not look the same in every setting or with every person. So it's important in your role as a care manager to develop partnerships with people by bridging the gap in services, having targeted outreach to your colleagues, and utilizing available community resources. It's also helpful to increase your health literacy, including the impact on the social determinants of health, the causes and side effects of some common illnesses, and preventative care. Supports, developing strong motivational interviewing skills. Motivational interviewing, I'm sure most of you have had training in that. I was discussed in webinars earlier this year and during the webinars over the past few months. And you should use your motivational interview skills to find out what is important to the person and develop a plan together on how to assist in goal achievement. You can acknowledge that change is difficult, but yet remain hopeful. And supporting concrete short-term goals. Short-term goals are just as important as long-term goals. It gives people hope and shows them that change is possible. And just a brief review of what motivational interviewing is. It's a client-centered directive method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. So motivational or use of motivational interviewing can really impact upon the relationship that you have with someone and actually can limit how much they engage with you if you're not practicing motivational interviewing. So an example of what motivational interviewing is not is depicted here in this next slide. The doctor says to the person, stop overeating, stop drinking, stop staying out late, stop fighting, stop worrying, stop eating sweets, and stop gambling. Then his wife asked him, so what did the doctor say? I don't know, I stopped listening. So this cartoon is no different than those that we work with and when we are trying to impose what we may think is best for them. This character may very well need to do all of the things to improve his health, but telling him and expecting change versus finding out what his motivation is to better his health would have yielded a better outcome. So to help find out what his motivation is or could be, the doctor could have used what is referred to as ORS. So ORS stands for asking open-ended questions. So an example of an open-ended question would be, how will your life change if this were to happen, as opposed to saying, will your life change if this were to happen? Providing affirmations, statements that support change. Saying to someone, you've done so well, you've met your daily step goal challenge, you set goals every day this week using your Fitbit. Also using reflective listening, which conveys that you understand what the person has told you or clarifying a statement that they've made. So saying to someone, it sounds like this means a lot to you and you want to make it right. At that point, the person may tell you, no, that's not what I really meant. This is what I meant. So it gives a chance for the person to clarify their feelings. And finally, summarizing or pulling all of the information together, reviewing the content of the conversation in order to gain clarity and making sure that both of you are on the same page. So you may sum up a conversation by saying, so this is what you've told me so far, and going on to summarize the content. And during all of this, when we're listening to motivate change, we want to make sure that we are considering one's culture, their values, trauma, and any strengths, and remembering the spirit of motivational interviewing. And in webinar number 7, talking about more acronyms, motivational interviewing and SPURT, the spirit of MI is having a partnership with the person. So you're going to partner with them in planning, decision making, anything that involves them, and not just having them present, but actually having them involved in the planning and the decision making. So you want to think about how we approach or you work with someone in developing that partnership. You also want to have evocation, so asking about ideas, opinions, and concerns. Asking the person, what has worked for you or what has not worked for you in the past? What do you think about doing this? How do you feel about this? And eliciting their feelings from them. Having compassion for the person. The folks that we work with, they are the expert in their own life. They know themselves better than anyone. And you want to make sure you account for their personal values and always highlight their strengths. We also want to have acceptance for those that we work with, honoring their autonomy. At times it may not exactly be what we recommend or what we think is best. However, like I mentioned before, people are the experts in their own lives, so we want to honor that and we want to respect that. And people are more willing to engage in the planning process if their choices are being honored. So you want to remember the spirit of MI at all times. Using MI with people who possibly use substance, or you want to assess for whether or not they're risk for using. So SPURT is not something that's going to be used to diagnose a person. It will be used to look for possible unhealthy substance use patterns or early intervention. So for an example, discussing side effects of drug or alcohol use with prescribed medication, or noticing when someone has increased their use. So we want to start off with screening and hopefully using a validating screening tool that can be used to assess for risk and what those risk factors may include. Examples of screening tools include AUDIT, which stands for Alcohol Use Disorder Identification Test, or DAST, D-A-S-T, Drug Abuse Screening Test. We want to use a brief intervention. This is where motivational interviewing can come in and can be very helpful, using ORS. So types of brief interventions could include frames, brief negotiating interview, and FLOW, which stands for feedback, listen, and understand, and options explored. These are further explained in webinar 7, so if you have not viewed that webinar, please view that for more details about those particular assessments. And finally, referral to treatment. Coordinating care if needed, and early interventions based on a person-centered client needs and their wants. You can explore what options fit their needs, their comfort level, and their culture. And engagement, motivational interviewing, and person-centered care and planning is extremely relevant to one's success. And we also want to factor in, like I mentioned before, one's culture. So in webinar number 10, Culture, People, and Me, Working with Diverse People, that particular webinar explores how culture impacts upon the people we work with and impacts upon engagement. And motivational interviewing, using it when working with someone, is almost useless unless you've developed a relationship with the person. And you can start doing this by trying to get to understand a person a little bit better and understanding what and who is important to them. And when we talk about culture, it's not just about religion or ethnicity or race. It is a way of life of a group of people that encompasses attitudes, their behaviors, beliefs, their values, and any symbols. that are accepted and passed along through generation, passed along through communication and imitation. So looking at culture, going beyond religion, ethnicity, or race, you want to consider someone's role, perhaps, in the community, within their family, any particular customs that are important to them, any expected behaviors that they expect from you, for themselves, from those that are important to them, their thoughts, and any manners of interacting that they deem appropriate. So you want to make sure that we are considering all of these different cultural factors when we're working with someone. And cultural competence, and you can be culturally competent and be also person-centered. So things to know when it comes to understanding one's culture is that it can be both experiential and inherent. So experiential meaning that someone, they can identify with a particular profession, perhaps, a common experience, or even the type of neighborhood that they grew up in. And inherent culture could be the country of origin, their country of origin, the primary language spoken or preferred language spoken, or belonging to a particular religious or ethnic group. And each of us has a different cultural identity. It's shaped by our experiences and our achievements. So identifying or a feeling of belonging to a particular group, having a self-conception or self-perception. So think about groups or affiliations that you yourself may identify with, and that's something that helps shape your culture. Cultural competency also means recognizing the recipient as a person and noticing or identifying any biases when they exist. Biases, we all have biases, whether we acknowledge it or not, but biases can be caused by differences in our culture and differences in our values. And those can include having stereotypes about a particular group of people, prejudice, stigma, or discrimination. And oftentimes it's influenced by other people, the media, and even news outlets. And not recognizing those biases often will impact upon engagement and service delivery. So it's important to look within yourself to see if you have any biases against a particular group or culture, and rectifying that in order to deliver the best services. The person-centered approach focuses on the person, including their needs, their wants, desires, and goals of the person as they define them. So the person-centered care is beyond just asking a person what it is that they want and need. It's actually implementing it and incorporating it into their plan of care, incorporating it into their daily life, incorporating it into your discussions with them and your engagement. And you cannot have person-centered care without incorporating those cultural preferences. So when it comes to culture and engagement, some cultural attributes that we want to take into consideration is, like I mentioned before, identity. So their person's race, gender, sexual orientation, religion, or family role, their language and literacy, and even the social determinants of health and how it's impacted them. So income, education, housing, employment, and even access to health care. And we can understand someone's cultural attributes by first listening, gaining a better understanding of the person and their situation, who and what is important to them, and being open to their response, being open to other people or strategies that they feel may be helpful to their recovery, and finally respecting their choices or methods of how they would like to receive services. It may not be the traditional approach. However, if they feel that it is helpful to them, we should definitely incorporate that into engagement and planning. And all of this takes relationship building and collaboration. It's always ongoing. It's not just during the first few meetings that you have with the person or during intake. It is ongoing throughout the entire working relationship. And so besides getting to know an individual or the person, you also want to get to know the community that you're serving. It's equally important in engagement. And you want to know what is the community's overall worldviews, their values, their attitudes, what their strengths are, what are the barriers in the community, and also what are some cultural supports within the community. So you can ask questions or research questions such as, what is this community's history? What traditions and norms exist in this community? What are the demographics and trends? Or what are the community's specific interests, needs, and assets? So again, going beyond just the person, but the entire community helps with engagement and incorporating culture and what is important to the person within your service planning. So we're going to switch gears a little bit and go talk about the value of outcomes, which has to do with culture and motivational interviewing a little bit as well. We hear out the word outcomes a lot, and sometimes, we dread hearing that word, or we're saying, oh, not again. What do outcomes have to do with me? But outcomes demonstrate value to various stakeholders, even yourself, if you're choosing the correct outcomes and collecting the appropriate data. So outcomes can give you things such as demonstrating the value of the service. Is there a need for additional resources? What are the barriers to success? Outcomes can help identify that and come up with a solution. Outcomes can give you the participants' goal achievement and help you understand what is getting in the way of goal achievement, or what has helped goal achievement. Outcomes also demonstrate staff performance, programs performance, as well as agency performance. So outcomes are important for everyone, the participant, the person you're serving, you as a care manager, your whole program, as well as the agency itself, and gives you all of this information. And it also addresses the triple aim, which is improved health, better care, and at a lower cost. So outcomes are important for everyone. And we can have some positive outcomes, or they can be achieved through a lot of what we've already discussed: engagement, utilizing of motivational interviewing skills, increasing your cultural competency and understanding the culture of the community, promoting and supporting integrated care, remaining person-centered throughout the entire working relationship, not just in the beginning as you're getting to know someone, incorporating it into the plan of care, so the person's long-term goals as well as their short-term goals, and utilizing systems that are already in place. So one way of addressing barriers to care and developing outcome measures for yourself, for the person, and your program can include the need to explore care transitions and developing possibly a care pathway. And care transitions and care pathways were talked about in webinar number 12. And as you see, care transitions, the definition of that is the movement of people between healthcare locations. So that could be between a primary care location and a specialty care within the same office. It could be between settings, so someone going between a hospital to, say, a senior center. It can be across health states, someone moving from a personal residence to long-term hospital stay or even hospice, and can also be between providers. Can be between a primary care physician and a mental health or behavioral health facility, if possible. So it's care transitions means just movement in, like again, in between settings or in between providers. And when we talk about care transitions, we may need to consider creating a care pathway. So care pathway is having a defined and standardized path to health that is comprised of both clinical as well as administrative steps or workflows. And so not everything obviously can be standardized. You may be able to standardize parts of engagement, but because people are individuals and you working with people have different cultural factors, you may be able to standardize some parts of engagement, but not all of them. And if you are developing or considering developing a care pathway, you want to make sure that the steps are replicable and teachable. So, for example, how care transitions are handled for from someone going from a personal residence to a long-term treatment facility. It can help you to hypothesize why someone is not achieving their long-term goals. It can also help to determine what are the barriers to someone achieving that. What are the barriers to your work or to the agency's work? So as far as engagement and using a care pathway for engagement, you want to activate people toward healthy behavior change, possibly using trauma-informed care, motivational interviewing, or even getting family or other supports involved, which can lead to possible increased health literacy, skill creation, and competence. Using a care pathway for screening, when you're doing intake and screening, developing clearly defined and standardized target parameters so everyone is doing a screening or intake the same way. We want to make sure the care pathway also is team-based, so you can possibly standardize who does what within a workflow, making sure that everyone knows what their job is, that jobs could overlap if a team member was not present, that other people on the team would know what to do. And in order to assess to make sure that your care pathway is working, you want to make sure that you're having ongoing quality improvement to assess the effectiveness and the efficiency of that particular pathway. As far as team membership, parties can include outside referral community providers. You want to make sure that your participants are definitely involved in developing these care pathways, even including a natural support. And also, as much as possible, make sure that it is transferable to other healthcare transitions once those protocols are developed. So again, you can find out more information about care pathways, care transitions, and webinar number 12. So we've talked about a lot of different topics, but they are all interconnected and related. And so the final two topics that I want to touch on in office hours is supervision and self-care. So supervision, a lot of us ask, is this really necessary? I talk to my supervisor all the time. I'm always asking questions. But supervision or formal supervision has a lot of opportunity for both the supervisor and the supervisee. It's an opportunity to address any changes that are occurring within the organization with your participants. It's a way of seeking and providing advice. It's also a way of developing rapport and trust. We talk about developing rapport and trust with our participants, but we also need to develop rapport and trust with our colleagues as well, and this is an opportunity to do so. Supervision is also a way of holding one another accountable. It's a way of holding not just the supervisee accountable, but the supervisor as well. If there's information or resources that you need from your supervisor, any other type of support that you need as a care manager, it is a way of holding your supervisor accountable to make sure that they're giving you what you need. It's also a learning and teaching opportunity, again, not just for the supervisee, but a learning and teaching opportunity for the supervisor. It serves as a way of making any decisions, whether it's about you as a supervisee, making decisions about how to work with someone or how to approach working with someone. It's also a way of negotiating any decisions made, problem solving, and sharing of knowledge and ideas. And during a supervisory session, you can also discuss any other trainings that you've been to, such as motivational interviewing, and goal setting and problem solving, and making sure that you also let your supervisor know what your learning style is. That's extremely important, and actually should be the foremost thing you do, besides all of this, is letting your supervisor know what your learning style is. Not everyone has the same learning style. So would you prefer to do case presentation?